asked if I had placed defunding Planned Parenthood on my brochure. I wasn't on the ballot. I didn't have a brochure, but I talked about it. The candidates around me talked about it. The candidates who were elected. We had crowds cheering while we were doing this. I know we have complete support at home, and I know that we have heartfelt repulsion, is the word, disgust back home from my constituents. But I'll go one step further. I attended political rallies, all the way from conventions, district, state. I attended presidential rallies, and I heard crowds cheer when somebody stood up to say that they were going to guard their tax dollars and ensure that they didn't go to the people who are listed in this bill, to abortion providers. Further, one level higher, we have our own Senator Ernst has recently filed legislation that would do the same, have the same effect at the federal level. President Trump has ran on this issue. I've heard him speak about it. The crowds of 10,000, 20,000 would cheer. Now that's all just superficial. That's just cheering. That's just the grassroots. I'd like to talk about the mechanics if that would happen. Imagine how states are going to deal with this, and it will be in a hurry, if they are not preparing to lose federal funding for abortion providers. If they are eliminated at the federal level, we're not doing this to get ready for the federal. I'm not supporting this because it's going to happen at the federal level, but this is going to be a good move for Iowa to be one step ahead of what's happening as a nationwide trend. I expect this to happen throughout the country. It is a wave that's moving across. There is certainly a trend, a tide coming in that's moving one direction, and I believe this is in compliance with that. But I'd like to talk actually about being a guardian of the tax dollar. One of our jobs is to make sure that when we spend a dollar in any program, that it actually receives the service that it is intended. We're to make sure that the taxpayer is not being bilked, they are not being defrauded. And I would contend here today that one of the vendors under this, and that would be Planned Parenthood, and specifically Planned Parenthood of the Heartland, has been cheating the taxpayer. I have the evidence I have for that I'd like to point out, and I'll just open with my request. I think it would be nice if the vendors under Medicaid were not under investigation, federal investigation for Medicaid fraud. Sue Thayer worked for 17 years as a manager of the Storm Lake Planned Parenthood office. She operated at the local level. She operated not as an undercover mole. She was a believer in providing the services, but after 17 years, she understood that providing those services wasn't the core purpose of the office. It was to expand the number of abortions. When they moved into the telemed, the tele-abortions, she couldn't do that. She understood that the women were not going to be served well, the same women that we're worried about here and that I'm worried about here. And she said she couldn't do it. She was fired for that, for not going along with the party line. So what she did then was realized that what she was part of was a grand theft scheme. And she started talking about it. I should point out, she was offered a huge amount of money to actually sign a non-disclosure to shut her up, and she couldn't live with the idea of taking the money and allowing this to continue to go on. I'd like to read a few of the allegations if I could. Birth control pills. I mean, just in that area, excuse me. In many cases, and I'm reading from her allegations, in many cases, Planned Parenthood dispensed birth control pills to clients who were not ever seen by a doctor or other qualified healthcare practitioner. We've heard that mentioned here before, but they're not being treated by professionals at Planned Parenthood. Instead, sometimes days after the client had visited the Planned Parenthood clinic and had been given birth control pills by an unqualified staff person, which is in violation of the standards of medical care and Iowa law, a healthcare practitioner who had never seen the client would sign off on the prescription. This is what our tax dollars are going to. Planned Parenthood took advantage of the complex but not closely managed. Remember, that was part of the issue, and it was brought up here today, the changes in our Medicaid, partially because so much of it was loosely watched, by buying birth control pills for $2.98 for a 28-day supply, and was reimbursed $26.32 for a 28-day supply by the Medicaid program. Now, I'm not here to say that is outright overcharging, because I'll be honest, I don't know, it's not my area, but I would like to move to the next, the next line, that it was well known the organization generated a surplus of at least $113 per client by billing for a monthly dose of birth control long before the prior month's dose had been depleted. And let's talk about that now. Okay, so we have this money being spent. This individual who qualifies for the program received their month of contraceptive pills. And before those pills are done, a new Medicaid claim was filed. And now here's the important part. I'm not worried about the dollars so much. Let's talk about what we're all concerned about. That fraudulent claim could have gone to another recipient. What they did was they stole money out of the program that could have gone to people who needed the service. So much of what we're hearing and what we're saying is that we want to provide services for people who may not have other access to it. And yet I'm hearing defense of an organization who is intentionally, greedily removing money from the program so that only 1/4 of the amount of patients can receive that service. Now, these allegations have been vetted for years. This goes back to 2012. Actually, a court actually dismissed this. It was appealed, evidence was brought forward, and we were looking at, and a federal court actually reinstated this just a couple months ago in 2016. It was last summer, but just this last year, federal courts put this back into place. I'm actually a little bit more interested, and this is to everybody. I am so ashamed of the tone of this debate. I got to admit, I'm a little bit glad that the cameras are down because so many things have been, get ready for Rule 9, but they have been catty and accusatory, and they've been argumentative, and Iowa deserves better than that. I'll admit it. I've heard you guys, one senator said he was ashamed. Well, you know what? I'm ashamed also. Come on. We can do better than that. So I bring you facts here that we can debate back and forth. Our patients deserve to have broader spectrum, non-ideologically aligned services. Now, whether the individual provider is a Republican or Democrat is irrelevant. Whether they support Roe versus Wade is irrelevant. But when it is to generate funds to promote an ideology, I would expect most of us, if not all of us, to say that that's probably wrong. It does not extend the services of our Medicaid dollars. And the reciprocal of that is that if it restricts, that it's restricting the number of people who can get that service. I think we can do better than that as a legislature, as a state of Iowa. People have said that the accusations couldn't possibly be true, and yet I guess I would bring up the point that Planned Parenthood of the Heartland is an affiliate, not separate, but an affiliate of the National Planned Parenthood, which, if we'll remember the films that came out, the films of taking baby body parts and selling them to researchers. I'm going to stay away from that. That's not in the bill, and you'd be right to call me out on it if I went any further on that. But ladies and gentlemen, we have a vendor who is willing to do this, and we're giving them access to our tax dollars. I don't know of another example, and maybe I will be corrected. Maybe we have another example of a Medicaid vendor who does this with tax dollars, that it's in federal court, having been reinstated because the evidence pointed toward truth. But I can't think of another example. I Googled it real quick, and when I came up with Iowa Medicaid fraud, all it mentioned was Planned Parenthood of the Heartland. That's in the news. Maybe there is another one, but I'd like to hear it. And I guess I'd like to ask, if these women are not receiving the services because somebody is stealing the money, why we haven't had an oversight committee look into this. For years, we've had the opportunity to make sure that as much money goes to as many different people as possible. I'm interested in us looking at it, to be quite honest. I'll broach the subject. We'll deal with that later. That's not part of the bill today. I'd like to finish with what she had, but Planned Parenthood illegally billed Medicaid for office visits, ultrasounds, RH factor tests, lab work, general counseling, and abortion aftercare, all of which were, when provided, integral or related to abortion on demand, which is not covered by the state's Medicaid program. Planned Parenthood did not disclose to authorities that these were parts of the abortion procedure. She said Planned Parenthood also overbilled Medicaid for contraceptive distribution that was covered by fraudulently charging customers for birth control prescribed without a mandatory medical examination. You've heard that part already, but here I read that to get to this part. At a higher rate than legally allowed, in excessive amounts, and sometimes without delivering the contraceptives themselves. A 17-year manager of a branch. Forget abortion. I can't hardly believe I'm saying that, but forget abortion. Ladies and gentlemen, it is our duty to watch and guard the tax dollars of the people of Iowa. And when the people of Iowa are mad that their dollars are going to this type of vendor, they have reason to be.